How do I know when it starts?
Now. Welcome to Passionate World Talk Radio. Educate, enlighten, and entertain. And tonight, the first show with Marianne Maeto is about everyone dies.
This show does not provide medical advice. If you're having a medical emergency, please call 911. Anything you hear here should be discussed with your primary care health provider. This show is intended for adult listening audiences, and listener discretion is advised. Hello and welcome to Everyone Dies, the radio show produced by Passionate World Radio, whose goal is to educate, enlighten, and entertain. I'm Marianne Maeto. I'm a nurse practitioner, and for the next 30 minutes, I'm going to be your host for this live call-in show. Please call 484-258-1876 with your questions, and we'll work with you to try to answer them. That number again, 484-258-1876. So I told you I'm a nurse practitioner. I've been a nurse since 1978, and I've worked a lot of different jobs. But for the last 25, 30 years, I've been working in palliative care and in oncology care. And in doing that, in talking with people and working at the cancer center and working with people receiving chemotherapy, I've heard a lot of questions from people about what confuses them about treatment or treatment decisions that they need to make. And in doing so, I thought, but I retire. What I would really like to do is answer people's questions and explain to them whatever's on their mind. And so we started this program called Everyone Dies. And the reason for that name is I guess we could have been less in your face about it and less saying, you know what, we're all going to die. But the fact is that we're all going to die. And as Americans, we really don't like to talk about that. It's one of those things that we say, can we just talk about something more pleasant? And that's okay. I mean, we can talk about anything, but the reality is that we're all going to have to face some decisions at some point in our life. And in working with people with cancer, they always assume that it's going to be the cancer that's going to be the thing that ends their life. But, it's not necessarily the case. You can have cancer and something else can happen that will put you in a position where, your life is in jeopardy. And so we never know what it is that's going to end our life. We never know what the circumstances are going to be, which makes it really hard to plan. And so we're here to help you think about what's going on, what kind of questions do I need to ask, what specialists do I need in order to make sure that your end of life is consistent with your life in general. You don't want decisions made for you at the end of your life that totally go against everything you'd want. So this is your opportunity to call in. The number is 484-258-1876. And I'm going to chat with you, and Lillian's going to break in when she has a caller, and we're just going to... I'll let you know.
TWTR, this is Lillian.
Hi, Lillian. How are you?
I'm doing fine.
My name is Sheila, and I just have a question for Dr. Maeto.
Yes, go ahead. You're on the air.
Oh, Dr. Maeto, I'm curious. Do you think that kind of a program or some sort of a curriculum on dying should be presented in high schools?
Sheila, you are a woman after my own heart. It has been 4 years that I mean, not 4 years, but for years I've been saying we need to teach. We need to normalize.
PWR Talk Radio, please hold. Thank you.
We need to normalize the fact.
Go ahead, Doctor.
That people die.
Hi, this is Betsy.
Okay, just a second, Betsy. Marianne, are you still there?
Yeah, I'm answering Sheila's question.
We seem to have lost Marianne. Okay, maybe she was, I don't know, her phone is still on. Marianne, are you still there?
Yes, I am.
Oh my, I didn't figure that we would have some problems like this, but everybody, you're listening to Everyone Dies with Marianne, and as soon as she comes back online, we will continue the conversation with Betsy Wurtzel and Sheila Wilson.
Sheila, can you hear me?
So, Marianne, are you still there?
Yes. Sheila, are you able to hear me?
Oh, her phone's still on the line. That's interesting.
There's a lot of severe weather storms out there.
I know. We had one this afternoon, and the thunder was so close it set off the fire alarm.
Oh, my God.
Oh, my goodness, that's scary.
And people were running out of their condos and their apartments trying to figure out where the fire was, which was difficult because there was so much noise from the fire alarm. You really can't hear yourself think.
Hey, Lillian. Right.
Hello, is Betsy?
It's Marianne. Are you able to hear me?
Yes, we are. Okay, Sheila's still here.
Oh, good. Yeah, I could hear all of you chatting, but I guess you couldn't hear me.
No, we did not.
Sheila, you were asking about a curriculum, and I think that curriculum really should start in kindergarten and just normalize the process of living and dying. To teach children, basic things like why do people die? Start using the word death and dying instead of, oh, they went to heaven or, oh, they passed on. No, they died, and it's okay to say that they died. And we started this not-for-profit, this Everyone Dies, with the idea that any funds that we made, we want to be able to give grants to grade school teachers to develop curriculum for kindergarten through 8th grade to start to normalize dying and death. There's curriculum for, sexual health and sex ed kind of thing. And I think that the next taboo is death and dying. And let's educate our children so that they say, yep, you live, you die, it's the circle of life. Right. And the reason I ask this is I've been very fortunate and have a lot of grandchildren and now great-grandchildren. And some of my grandchildren, when I sat them down and told them what my husband and I were going to do, when we die, I want them to know right out, they cried. And they said, I don't want to hear it. And I thought, oh, aren't you going to be surprised when we're gone and we're not going to do the routine that's out there? And I think it's very sad. But
it is.
Thank you for your response.
I know.
And I'd like to make one more comment.
I know that you find
and
it sad.
This is basically to Betsy. You did a fabulous show the other day when you got interviewed. I don't know if it's appropriate to say this right now, but it was awesome. But thank you, Dr. Maeto. I am going to fight for some sort of a curriculum in the high school to teach the children that everybody's going to die someday.
Keep in touch with us, and maybe we can help, because that's one of our agendas. We want kids to learn.
We can do it through the radio station, ladies.
Oh, excellent idea.
We can teach it through the radio station.
Yeah.
Okay. Our webpage is everyonedies.org. It's EBERY, the number one, dies.org, or you can get through to us through the radio station. So please stay in touch.
PWR Network LLC at gmail.com.
Bye.
Bye.
Please call in with your questions to 484-258-1876. Is Betsy there with her question?
She was here, but she seems to have faded.
Oh, all right.
All right. So, which happens?
Well, I'm sure she'll come back. So our goal in terms of our program here is to help everyone have an understanding of dying and death, help them to remember that death is normal, it's not optional. And I know that kind of sounds odd that, of course, everyone dies. We know that. We know it on some level, but we don't really believe it. So there's a joke about how death is viewed in the United States, and it is that in India, death is seen as a potential step away from reincarnation and towards nirvana. In Europe, death is seen as an existential tragedy we all must face. But in the U.S., death is seen as optional. But of course,
Passionate World Talk Radio.
Hi, Lillian. This is Betsy. My phone call got dropped, and I couldn't get through.
Oh.
But I'm here.
Hi, Betsy.
Hi.
Do you have a question for us?
Do you have a question, Betsy?
Yes. Is Marianne on?
Yes. Just
Yes.
talk.
Yep. Hi, Marianne. Yes, I have a question about terminal agitation. Matt had terminal agitation even though he was walking, yet the hospice team didn't realize that. Can you explain to us what terminal agitation looks like for those who are walking around still?
So what Betsy's talking about is something that you see when people are close to their death. So it's called terminal agitation. They might get annoyed. They might get irritable. One of my patients that I had when I was working as a hospice nurse, the family called and said, he's so agitated. He's just so mad. Can you come out? And this man was, just like abusing the newspaper. And I said to him, what are you looking for? And he said, I'm looking for my obituary. And I said, your obituary? And he's like he was just so annoyed. Yes, my obituary. I said, well, they don't print your obituary until you die, so it's not going to be in the newspaper. And he just swore, and he was just mad. And so it's terminal agitation is just like this anger, agitation over something you really can't fix. Like I couldn't point to the newspaper and say, here's your obituary. There was nothing that I could do for that. And sometimes you can calm people down, but sometimes, and a lot of times, you need to use like an anti-anxiety medicine to help calm them down. Use, Ativan, use Haldol, so something that's going to calm them down, because it's not that they're agitated that they're going to die, but their body is in a process where it's starting to shut down. So you might see people looking through drawers and looking through closets, and you say, what are you looking for? And they're just mad that it's not there. Or sometimes people who aren't still walking around, you might see them like picking at their blankets, and they just won't lay still. They're not calm. They're agitated in sort of a mild way because their bodies are so sick. And those are things that are distressing to the patient, and if they're still moving around, distressing to the family. And, should be medicated so that, and we say, people say, I don't like using a lot of medicine. At the end of life, in those last hours or last days, that's a very appropriate use of medicine. It's the time to use medicine. The calm people, help people to breathe, to treat whatever symptoms that they're having so that their end is a peaceful end. Did that help answer your question, Betsy?
Yes, I would just like to put it out there in case there's any people that are hospice personnel to really listen to the caregiver and to assess the patient and not just to, shove off the caregiver like we don't know what we're talking about, because we know our loved ones better than anybody. And
Absolutely.
We just have that intuition. So, Matt, they didn't believe me. Like, it would take Josh to hold Matt up so I could change Matt. But when he was agitated, he'd spring right up like a jack-in-the-box and start walking. Of course, he would fall, but they didn't believe me until he went up to the hospital unit, and then they saw what I was talking about. But thank you, Marianne.
Oh, thank you, Betsy, for everything. You do a great show. We so appreciate you.
You're welcome.
Betsy's show, should those who want to know, is called Chatting with Betsy Wurtzel. Go check her out on PassionateWorldTalkRadio.com. She does interviews as well as discuss caregiving for people with Alzheimer's, dementia, and Parkinson's.
She does a great
Thank you, Lillian.
You're welcome.
Have a good night. Bye-bye.
Bye.
Bye. The calling number is 484-258-1876 with your question. Do we have anybody on the line, Lillian?
No, those were the only two that have come in, but I think if people realize they can only call in one at a time and they need to wait until the current person is finished before they dive in, we'll be able to handle all the calls that will be coming in.
Okay, well, I'll keep chatting, and if somebody calls in, just let me know.
I certainly will. You always hear Passionate World Talk Radio for me answering the phone. That would be your clue words.
Excellent. Okay. Can you all tell that this is our first time doing the show? I've got to learn the ropes.
That's okay. That's what it's all about. And people will come back to see how well you're doing with your ropes.
Excellent. So, remembering that we're all born, we all die, and as much as we can fight a disease, if it's a terminal illness or a life-limiting illness, there's something that's going to come along that's going to end our lives. And, people might say, well, what does palliative care have to do with somebody with Alzheimer's disease? What does palliative care have to do with somebody with Parkinson's disease or heart disease? Palliative care is a type of care that starts at the time of a person's diagnosis. So anything that can actually end our life is something that palliative care can help with. What we do in palliative care is help with symptom management for people who have a life-limiting illness, and we start at the time of diagnosis. So if you have diabetes, that's a life-limiting illness. If it's not managed, and even when it is managed, it may be something that will shorten a life. Parkinson's disease, Alzheimer's, cancer. So when people think of palliative care, they think, oh, that's about cancer, right? Or they'll say, oh, that's hospice, right? Well, let's be clear. Palliative care is not hospice. Palliative care starts at the time of diagnosis, and it goes all the way up to wherever hospice is going to start. Now, in our country, hospice is like an insurance benefit. Almost all insurances have a hospice benefit, and it is written to start 6 months when somebody has a 6 month or less prognosis, meaning that the healthcare practitioner thinks that this person is going to die within the next 6 months. Now, how does the healthcare practitioner know that? Well, in reality, they really don't, because we don't have a crystal ball. We can look at objective things like how much urine is being put out and how much are they eating or how much weight loss they've had. But it's really hard to tell. And we're right sometimes and we're wrong sometimes. And mostly in the United States, we're wrong. you look at the average time that people start into hospice, it's like less than a week when it's a 6-month benefit. We wait far too long to say, you know what, it's time for hospice support. Now, what if you live 7 months or 8 months or 10 months? Nobody throws you out of the hospice benefit. They think, oh, great, we started early enough. So start earlier. The benefit is fantastic in the United States. It pays for all your medicines related to the disease. If you need any durable medical equipment like a hospital bed or any kind of equipment like that, it provides that. As with no deductible, part of the insurance. Registered nurses coming out, home health aides, bereavement services for a year after the death. So it is fantastic in terms of the benefit. But people don't like to elect that hospice benefit because they say, well, hospice, that's where you go to die. Well, again, we all die. And if you have a terminal illness where your healthcare practitioner wouldn't be surprised if in the next 6 months that you were to die, then it's time to elect that benefit. And if you live a year, that's great. It doesn't matter. They just recertify you. And, you know, if you need to go to the hospital, if you decide, no, I want to unelect from my hospice benefit, you can do that. You can unelect and reelect as often as you need to. And so it's a fantastic opportunity in terms of getting really expert care. So palliative care starts at the time of diagnosis, and it goes all the way up until that time when you elect your hospice benefit. And it manages pain and symptoms associated with your disease. So if you're having pain issues, let's say that you have cancer. Let's say you have ovarian cancer, and you're having pain, and you're having sexual health issues, and you've developed neuropathy from your chemotherapy. Well, if you go to your oncologist and say, I have all these things, are they going to be able to expertly manage those symptoms? Well, I can tell you no. First off, they only have 10 or 15 minutes for your visit, and they are going to want to focus on your cancer treatment plan, and you're going to want them to focus on your cancer treatment plan because that's what they do the best, right? But if you go to see the palliative care practitioner, you know, in your cancer center, then they have, 15 or 30-minute appointments where they can focus on your sexual health issues, your neuropathy, your pain. And that's what they're expert in, and that's what you want them to do. It doesn't mean that you're dying. It means that you have a disease that's either giving you symptoms or the treatment is giving you symptoms. And they are the ones who are able to manage it. And that's what palliative care does. And they stay with you all the way through. And I worked in a palliative care clinic in our cancer center, and there would come a time where we would, the oncologist might say, we don't have other chemotherapy treatments, or there's no more surgery, we've kind of gone through it all. And then we would be able to say, and so what would you like your next step to be? We can refer you to hospice, and here's the benefits that they could provide for you. And one of the best benefits is that they come to you. You don't have to, get yourself into the car, drive in from, wherever it is that you live, and try to, get into the cancer center, wherever that care is being taken place. Hospice will come directly to you. It is so much easier to get your care, and they manage every symptom that comes your way. But when you go into hospice, you're not going to be getting the chemo anymore. There's not going to be more surgery or that kind of thing. But at that point, that's what the appropriate care is.
PWTR.
Hi, are you guys doing the Everyone Dies special at
Hello?
6 Eastern Time right now? Hello?
Ask your question.
Oh, I wanted to know what
Hello?
you do if... Hello?
Don't be shy. I don't know, they called in, but, and time is ticking away. You need to wrap it up soon anyway. We're up to 25 minutes.
Okay.
What you can
So there are
do
some things that we
someone
can
you're
control
close
when
to
we're
doesn't
facing
want to
life-threatening
talk about their
illnesses,
end of life
like
care,
how
how
much
you can
treatment we
encourage
have,
them
the
to
use
kind
of artificial
be
food and
open about
fluids,
it.
advanced care planning. But without the information about what those things are, what the pros and cons each of those hold for you, how are you going to make a good decision? So our work will give you the details as to how do you make decisions that are consistent with the way that you've lived your life. That's what we want to be able to offer to you. So we're here on Passionate World Talk Radio every Wednesday at 6 p.m. Eastern Standard Time. We'll answer your questions, and we hope that you're going to join us and let us kind of talk through the questions and problems you might have. Thank you for spending time with me during our show, Everyone Dies. You can read our blogs and listen to our other podcasts at everyonedies.org. That's EVERY, the number 1, dies.org. Remember, you can listen to Passionate World Talk Radio on Spreaker and our shows wherever you listen to podcasts. We're here every Wednesday, 6 p.m., to take your calls and answer questions related to life-threatening illness, dying, and death. Live your best life every day, and remember that every day is a gift. Thank you for joining us.
And thank you all very much for joining us. If you want to hear this particular podcast all over again, please go over to https://passionateworldtalkradio.com. Right-hand side menu, find everyone with the number 1 dies. Click on it, and you can hear it. You can also, if you're technologically challenged, you can also call up a sizzle line, which is a phone number. Just whip out your handy dandy cell phone, put in the number, and you'll hear the recording immediately. Thank you all very much for joining us. And remember, next Wednesday, 6 p.m. Eastern with Dr. Marianne Maeto.